Hello everybody, this is a quick video on the Radiant Warmer, which according to your skills check sheet is skills 2.2, regulating temperature using an overhead radiant warmer. When you come into this simulation for a checkoff, you won't be actually physically touching anything. It's more of a verbal walkthrough of your skills checklist. And your skills checklist is in your Taylor's Clinical Nursing Skills. And so the big thing with the warmer, most of the time we put the baby skin to skin. In other words, we put a diaper on the baby and we place the baby on the mom's chest. Her skin and body temperature makes a better warmer than anything as long as we keep the baby dry. And then cover baby over with a warm blanket. Out of safety, these warmers have wheels. You want to make sure that the wheels are always locked. And you never ever want to have a baby up here in this warmer with any of these sides down. That's a safety factor. So really important. Usually you lift them up and then they kind of swing out to the side. So you will be able to wear gloves anytime that you're working with our mannequins or equipment. We just have to clean everything down. So basically with this, the first thing that you would do, some of the newer warmers, they stay on at all times, and they kind of have a bar to the back, and we can show you when you come into lab that they stay at a minimum kind of level so they don't have to completely warm up. There's heaters up here in the top of these, and this is a real safety thing with this piece of equipment, is that you can actually burn a baby if you don't use this piece of equipment correctly. So that's why this skill is so critical. So of course when you come in, typically we'll have babies in these warmers if we have to look at them and we want to keep them warm and we can't lay them on mom's chest. Sometimes we do their bath, warm them after a bath. If we need to see them, their chest, if they're having breathing problems or anything like that, we'll also sometimes place them in these warmers. So, and at Frankfurt, commonly you'll see them in these warmers whenever we do what's called their 24s. We'll talk about that in class, as well as when you do a newborn screen, and also the erythromycin ointment in the eyes and the vitamin K or the hepatitis B in the leg. A lot of times it's a lot easier to get to the baby in this warmer, plus it helps keep them warm. So going through your checklist, the first thing, of course, you would not necessarily, according to your checklist, it says you have an order. But basically, you want to keep your babies warm. You're going to continuously monitor vital signs and temperature. That can be a sign, especially with babies, if it's really, really low or high, that they're really sick. And so for temperatures, of course, typically we always try to take them under the arm. Even though there's a variety of devices, we do not add a degree. Whatever you get under the arm is what you get. A lot of times moms tend to overdress or underdress preemies. Preemies don't have as much body fat to keep them warm. So you're going to do your hand hygiene, of course, when you enter the room. You're going to have your PPE on, such as your gloves. Of course, you would provide privacy. All of our rooms at Frankfurt are private rooms, but in the nursery, we do have a main nursery, and most of the time the babies stay out with the moms. Make sure that the warmer is plugged in. It does require electric to turn it on. There's a power on button up here on the top, and of course it tells you here on this piece of equipment not to turn it on because it could ruin our mannequins. It could actually melt our mannequins, but you would turn the warmer on. On the back part of the warmer, you would see some lights come on, and on this model, it already has it preset at the temperature that's on your check sheet, which is 36.5 or 97.7 degrees Fahrenheit. We don't want to overheat our babies too much, so we have time. They come out wet. You know how you feel when you get out of the shower. It's easy to get cool, especially if you're wet. So we dry our babies. We put them skin to skin. If we have to put them here, make sure that your setting should be set at 36.5. Now, it may be different at different facilities, so always check with them. So the next thing you have is you have this probe cover. A lot of times these will adjust to a maximum heat or to that temperature that's preset unless you change it on what's called servo mode. This particular model says manual mode, so that means whatever you adjust the temperature to. And it has this wire, and so what this wire does, you would get a little what we call a hydrogel pad. There's a white side on the wire and usually a shiny side on the wire. The shiny side usually goes on the sticky pad, and the white side will go on the baby's skin. The big thing about this probe is you don't want to put it over bone. Typically, you'll put it over the liver, just below the ribs, but either side is fine, or somewhere on the abdomen, just so it's not over bone. And then what happens, then you would change your monitor on the back to where it says servo mode. And what happens is this little monitor will continuously measure the baby's temperature and tell this equipment whether it needs to heat up to get to that preset temperature, or whether it's too hot and it needs to cool down. You will see at times, if a baby's just laid here for a short second at Frankfurt, they may not attach that probe. But it is a big safety factor to leave a baby in here without this probe in here. Most of the time anymore, at most facilities, this whole wire is usually disposable, so you get a new one each time. Sometimes you have to wipe down the whole wire, and just the hydrogel pad is something that you throw away. But basically, once you put the baby in here, you attach that, you continue to monitor vital signs, and basically you want to watch your baby and make sure, and feel. You can feel the heat on your arms from these. So again, once you've hooked up, got everything set up, changed it to servo mode, then you can take off your gloves and perform your hand hygiene as you exit the room. If you have any questions, just ask your clinical instructors.